Um, Hello friends, hi. Good evening. Myself, Dr. Abhishek Kumar Dubey. I'm your mentor for surgical dentistry and corticobasal implantology. I would like to wish everyone a very happy Independence Day. Um, I'm back again with a case discussion. Okay, I did this case 3 to 4 months ago. It was a segmental rehabilitation in the anterior region using corticobasal implants and PFM prosthesis. To give background about the case, I would like to say that the patient had a aberrant congenitally placed teeth along with multiple situations of deep bite and cross bite. So we'll just see and I'll walk you through the case and how we did it. Very simple protocols were used because of the extreme deep bite. There was hardly any space between the lower anterior teeth and the upper anterior teeth. So we managed the case with whatever was available. So let's proceed, okay? So here you can see the case, okay? And the man, it's this picture is actually a post-op picture. I just want to tell you that the upper right is the natural tooth, okay? And these four teeth you see in the upper left region are the teeth which have been rehabilitated using basal implants, okay, upon PFM prosthesis. So the satisfaction of the patient is visible in the smile, okay, but we'll see how we manage it, okay. So if you go to see, the most important feature is this tongue peeking out through this window. This is the central incisor of the left side and this is the central incisor of the right side. So you can see there's a 14-13 millimeter gap between two. Here it's far more obvious. You can see width of two tooth and you can see how closely approximated this junction is. So managing the occlusion was the more trickier part rather than the surgery in this case. And if you see and appreciate, you can see the cross bite involved and the obvious deep bite involved, okay. So the planning was this is the second premolar, the first molar. That means this patient had a total of 3 teeth missing, which is left lateral incisor, left canine, and left first premolar, and the left central was aberrantly placed. Okay. So what we did was to remove the aberrantly placed central incisor, and I gave sutures. You can see the sutures well placed. I just want to inform you that this whole case was completed in less than 60 hours of time, and I did 2 implants in this case. Okay. The first implant was a midline implant engaging into the anterior nasal spine area. The implant was placed right in front of the nasopalatine foramen. Okay, and the second implant was this one in the first premolar area. Upon extraction of the aberrantly placed central incisor, I gave sutures, and simple alginate impressions were made, and the technician was asked to do the metal trine, and upon careful jaw relation, we were able to correct to some extent the involvement of the occlusion which was earlier visible, and therefore we obtained a much harmonic bite positions on the left anterior region. And after the metal trine, the definitive prosthesis was given to the patient. As you can see, this was the pre-op condition of the patient, and the beautiful alignment and the harmony in the post-op condition of the patient. So there was not much of surgical legacy involved in this case. The trick was the planning on the jaw relation and the management of the occlusion. We also had to do some of the incisal grinding of the lower teeth to get the necessary results, both on the slightly on the incisal surface and to some extent on the labial surface. Otherwise, there was no problem with the patient, and the patient is still under follow-up, and he reports that he is doing fine. That's it for today. Thank you. Jai Shri Ram.